Hello dear students, my name is Rahul Chuk and I welcome you all to my YouTube channel Farmverse. Today we will going to see some important objective questions from the topic capsules, solid dosage forms. This is basically the part 1 from this topic. Part 2 will going to be released soon. Without wasting any further time, let's get started. So moving on to the very first question of our today's session, and that is the ratio of the dry gelatin and the dry glycerin in a soft gelatin capsules is. So we have to tell कि dry gelatin and the dry glycerin की कितनी ratio होती है in a soft gelatin capsules में. And the options are 0.4/1, 0.6/1, 0.8/1 या 1/0.8. So for soft gelatin capsules, a dry gelatin to glycerin ratio of around 1:0.8 ensures proper elasticity, sealing, and structural integrity. So we can say option D, that is 1/0.8 is the required ratio of dry gelatin and the dry glycerin in a soft gelatin capsule. Moving on to the next question, identify the salt that is used for polishing the capsules. And the options are sodium bicarbonate, starch, ammonium chloride, yeah, sodium chloride. So after capsules are manufactured, they are often polished to remove any residual powder or oils. A common method that involves tumbling the capsules in a salt pan with a fine powder of ammonium chloride, which acts as an abrasive polisher. So we can say option C, that is ammonium chloride is a salt out of the given four options that is used for polishing the capsules. Moving on to the next question, the approximate capacity of a 1 number hard gelatin capsule is, and the options are 150 mg, 300 mg, 450 mg, या 650 mg. So for a 1 number hard gelatin capsules, it holds around 300 mg depending upon the powder density, a standard used in the formulations. So we can say option B, that is 300 mg is the correct answer for this question. So moving on to the next question, type B gelatin has an isoelectric point of. So we have to tell that out of the given four options, टाइप बी जेलेटिन का आइसोइलेक्ट्रिक पॉइंट में से कौन से पीएच पे अटेन होता है. एंड द ऑप्शंस आर pH 7.2, pH 4.7, pH 8.9 या pH 5.8. So type B gelatin, it is obtained by alkaline hydrolysis and has an isoelectric point of pH 4.7, which affecting the solubility and capsule performance. So we can say option B, that is pH 4.7 is the correct answer for this question. Moving on to the next question, capsules normally fall into two main drug categories, and which are they? So we have to tell out of the given four options, the capsules normally fall in two main categories, and out of this, what are they? So options are hard gelatin capsules and the soft gelatin capsules, hard gelatin capsules and the layered capsules, soft gelatin capsules and the compressed capsules, yeah, compressed and the layered capsules. So the capsules and they are basically classified into hard, that means for solid fill, and soft for semi-solid or liquid fill gelatin capsules based on their shell compositions. So we can say option A, that is hard gelatin capsules and the soft gelatin capsules is the correct answer for this question. Moving on to the next question, which capsule number represent the maximum capacity? Options are 000, 5, 4, yeah 0. So the capsule size ranges from 000, that is considered to be the largest one, to 5, that is considered to be the smallest one. So 000 holds the highest volume, that is of around 1000 mg. So we can say option A, that is 000 is considered to be the right answer for this question. Moving on to the next question, the plasticizers used in the capsule shell is, options are silicons, glycol ester, talc, या glycerol. So glycerol is a plasticizer that adds flexibility and prevents the brittleness in soft gelatin capsules shells. So we can say option D, that is glycerol is used as a plasticizer for capsule shells. Moving on to the next question, capsules are which type of dosage forms? Options are solid dosage forms, liquid dosage forms, semi-solid dosage forms, या gaseous dosage forms. So capsules are considered to be the solid oral dosage forms with a shell that contains solid, liquid, and semi-solid medications. So we can say option A, that is solid dosage forms, is the correct answer for this question. Moving on to the next question, capsules that that does not disintegrate into the stomach but break up in the intestines are known as. Options are sustained release capsules, enteric coated capsules, rectal capsules या soft gelatin capsules. So जो enteric coated capsules होते हैं that basically resist the acidic gastric fluid and dissolve in the intestinal pH, protecting the drug and the gastrointestinal lining. So we can say option B, that is enteric coated capsules, is the correct answer for this question. So moving on to the next question, hygroscopic or eutectic substances filled in hard gelatin capsules as adsorbents includes. Options are oxides of magnesium, carbonates of calcium, kaolin, yeah, all of these. So these adsorbents are used to absorb. When we say these adsorbents, basically includes all the above, means oxides of magnesium, carbonates of calcium, and kaolin. These are used to absorb the moistures or the oily component in the capsule fills, common excipients for the problematic APIs. API stands for active pharmaceutical ingredient. So we can say option D, all of these is the correct answer for this question. So moving on to the next question. In a hard gelatin capsule, the approximate capacity of capsule number 0 is. Options are 950 mg, 650 mg, 450 mg, or 300 mg. So a zero number capsule typically holds around 450 mg of average density powder, a popular size for the OTC medications. OTC basically means over the counter medications or the non-prescription medications. So we can say option C, that is 450 mg, is the right answer for this question. So moving on to the next question. If a capsule is numbered as 000, and which means options are it is the smallest size capsules with a capacity of 100 mg. It is for the inclusion of ophthalmic ointments only. The shape of the capsule is oval. Yeah, it is the largest size and for veterinary purposes. So the capsule size that ranges from 000, that considered to be the largest one, and to 5, that is considered to be the smallest one. Size 000 holds up around 1000 mg and it's typically used for the veterinary or high doses applications. So we can say option D is the correct answer for this question. So moving on to the next question. Which one of the following is a correct statement regarding soft gelatin capsule? And the options are soft gelatin shells may contain methyl in the propyl paraben as a preservative, not suitable for use as a suppositories, not suitable for ophthalmic ointments. Yeah, the manufacturing and the filling of medication are done in a separate operations. So options A, that is soft gelatin shells may contain methyl and propyl paraben as preservative, is considered with a correct statement, as these preservatives prevent the microbial growth in soft gelatin capsules which contain moistures and are more prone to contaminations. So we can say option A, that is soft gelatin shells may contain methyl and propyl paraben as preservative, is the correct answer for this question. So moving on to the next question, the role of glycerin or sorbitol in the manufacturing of capsule shell as. Options are preservative, flavoring agent, opacifying agent, या plasticizer. So जो glycerin and sorbitol होते हैं that basically increases the capsule shell flexibility by acting as a plasticizer, preventing the brittleness in soft gelatin capsules. So we can say option D, that is plasticizers, is the correct answer for this question. So moving on to the next question, the approximate moisture content of a hard gelatin capsule in a normal condition is. Options are 3 to 6%, 13 to 16%, 20 to 25%, or 7 to 10%. So hard gelatin capsules maintain a moisture range of around 13 to 16% to preserve the shell integrity without becoming brittle or sticky. So we can say option B, that is 13 to 16%, is the correct answer for this question. So moving on to the next question, which of the following is a water immiscible liquid encapsulated into the soft gelatin capsules? Options are ethoxylated sorbitan, polyether, secondary alcohol, or chlorinated hydrocarbon. So chlorinated hydrocarbons are the water soluble and suitable for encapsulation in soft gelatin capsule to deliver lipophilic drugs. So we can say option D, that is chlorinated hydrocarbon is a water immiscible liquid encapsulated into the soft gelatin capsules. Moving on to the next question. Capsules making the bloom strength of a gelatin is proportional to the molecular weight of gelatin is a measure of the. Options are cohesive strength of the solvent molecule, cohesive strength of the cross-linking that occurs between gelatin molecules, adhesive strength of the gelatin with dipping pins, yeah, adhesive strength of gelatin with other polymers. So the bloom strength quantifies gelatin gel firmness and reflects its molecular weight and cross-linking density, key to capsule shell quality. So we can say option B, that states cohesive strength of the cross-linking that occurs between the gelatin molecule is the correct answer for this question. So moving on to the next question, the physical properties such as gel strength and viscosity of a gelatin are expressed at, options are stiffness factor, partition coefficient, Bloom strength, a pH and pKa value. So the Bloom strength is a standard measure for gel strength and the viscosity in the gelatin used for capsules and the confectionery applications. So we can say option C, that is Bloom strength, is considered to be the right answer for this question. So moving on to the next question. Solid fills for the hard gelatin capsules frequently contain which is falling excipients as a disintegrant. And the options are glycans, lactose, magnesium stearate, yeah, starch. So starch basically swells upon hydration, which helps in the capsule disintegration and the drug release. It is a widely used disintegrant in a solid fill capsules. So we can say option D, that is starch, is the correct answer for this question. So moving on to the next question, capsules in which powders unenclosed are made up of gelatin, rice flour, fructose, or dextrose. Gelatin is a standard material for capsule shells due to its ability to form a flexible, dissolvable container for powders or liquids. So we can say option A, that is gelatin, is the correct answer for this question. So moving on to the last and the final question of our today's session, and that states Bloom strength that is used to check the quality of, options are lactose, ampules, avicle, या gelatin. So जो bloom strength होती है that basically helps you to determine the gel firmness of gelatin, essential for capsule performance and consistency. So we can say option D, that is gelatin, is the correct answer for this question. So I hope these MCQs will going to help you to sharpen your preparation. That's it from my side. This is basically the part 1 from this topic, that is capsules, solid dosage forms. Part 2 will come soon from this topic on my channel, so stay tuned. And if you like the video, don't forget to like, subscribe and hit the bell icon for more pharmacy insights. Thank you.